Hello and welcome to Steps for Success, a surgical preparation class for patients undergoing total knee or hip replacement surgery. It is our privilege to care for you. You have a whole team on your side, and we will be here for you every step of the way. We thank you very much for entrusting our team here at St. Joseph Regional Medical Center with your care. Some of the things we will discuss include general information about joint replacement surgery and how you and your family can be involved as the most important members of your healthcare team. Who else will be on your team while you are in the hospital? Possible complications after a joint replacement surgery. How to prepare your home before surgery. Improving your outcome by being healthy before surgery. Planning ahead. What to expect from before surgery to after returning home. Concerns after surgery, as well as when and who to call. We will then learn some exercises for you to practice before and then after surgery. And then we will demonstrate some equipment that may be helpful to you as you transition safely back into your environment. You will also be provided with contact information, which can additionally be found in your patient education booklet for total joint replacement. There are different reasons why you may have decided with your surgeon that this is the right time for you to have a total knee or total hip replacement surgery. The most common goals of joint replacement surgery are to reduce your pain and symptoms and improve your quality of life. In other words, help you get your life back from pain and limitations. Many patients undergo total knee or total hip replacement surgery every year. Here at St. Joseph's, we care for a high volume of joint replacement patients annually, which means we provide an extra level of expertise. Please rest assured that you are in good hands. Again, we thank you for entrusting us with your care, and we recognize that no two patients are exactly alike. We closely monitor our program and our patients' outcomes, and we work continuously to achieve a smooth process with excellence and safety for our patients. One of the things that empowers us the most to be the best we can be is your feedback. Please provide us with feedback along the way. You can give this to any staff member at any point. Your insight is invaluable to us. Your commitment to this process is imperative. When patients are highly involved in their care before, during, and after surgery, they generally have better outcomes. Gone are the days where you do something just because your doctor or nurse told you to. We want you to know and understand and be active in the conversation and decisions regarding your care. This concept is known as shared decision-making. Even if your surgery is weeks or months away, start preparing now. Starting your pre-operative exercises before surgery can help your brain and body to be more successful with movements after surgery. One thing that is very important is for you to identify what your goals are ahead of time. Then, keep your goals in mind as you travel through this process. What are you hoping to get back to after surgery? Exercise, playing, hunting, gardening, working, or dancing? Keep your eye on your goal, especially when you are having pain. It is a great way to propel yourself toward a smooth recovery. In other words, look through this time frame to your healthier future. Total knee or hip replacement surgery means that your surgeon makes an incision over your joint. Damaged surfaces and parts of your joint are replaced with new artificial pieces, which are fitted and secured to the bone. Knee and hip replacements generally last for many years. Several factors can affect the longevity of your joint: body weight, activity level, bone quality, and overall health. Take care of your whole body to take care of your new joint. Most joint replacement surgeries go very well, but we want you to be aware that there is a chance of complications. This is not to scare you, but rather to then discuss what can be done by you and your whole team to help minimize your risk of complications. Here are some of the most serious complications to be aware of. First up, infection. Surgical site infections can lead to additional surgery, disability, and antibiotics. There is also a risk of developing other respiratory, skin, or urinary tract infections. Next is nerve damage. This can lead to permanent or temporary disability. Bleeding. Bleeding can lead to the need for a transfusion or other fluid replacement. This can be life-threatening if not immediately treated. You could also have a loosening of the implants in your new joint. This can lead to additional surgery. Other possible complications include an adverse reaction to anesthesia, such as a heart attack, breathing difficulty, or death, or an adverse reaction to any of your medications, such as an allergic reaction. The last complication we will talk about is blood clots. Blood clots are a serious, life-threatening risk after lower extremity joint replacement surgery. Typically, blood clots form in the calf area, but they can also form in the arms. There is a risk they could travel from your limbs to your heart or lungs. There are many things that we do to help greatly minimize your risk of forming blood clots after surgery. You will have soft compression sleeves on your feet. These are also known as sequential compression devices, or SCDs. You will be up and walking the same day of surgery. Your surgeon expects it. You will learn some exercises called ankle pumps, and we will encourage you to stay hydrated by drinking plenty of fluids, both in the hospital and after you go home. We will monitor you closely throughout your stay and teach you about the signs and symptoms of blood clots. Please know the signs and get help if you need to. Your healthcare team includes an anesthesiologist and a certified registered nurse anesthetist. This is a physician or an advanced practice nurse that is responsible for your anesthesia or putting you to sleep and controlling your pain for surgery. A discharge planner is a member of the social work team that will work closely with your surgeon, care team, and you to help make decisions and arrangements for your discharge process and destination. They can also help answer questions about insurance coverage for services or equipment you may need after surgery. Environmental services or housekeeping will be in and out of your room, helping to keep it clean and comfortable. They help to maintain our environment of safety and excellence. A hospitalist is an internal medicine physician who is employed by the hospital. They may be asked by your surgeon to help oversee and manage your entire state of health during your stay. Occupational therapists may be asked by your surgeon to assist you in learning how to use certain adaptive equipment. This equipment can help for a smooth transition back to self-care after surgery. Specifically, they teach you how to complete your activities of daily living, or ADLs, independently. These activities may include toileting, dressing, and showering. Next, our chaplains or pastoral care are here to visit with you about anything you would find comfort from talking about. From fly fishing to your Creator, it's up to you. They offer prayer support and communion if you would like. In addition, our chaplains offer assistance with completing advanced directives free of charge. Each member of our pastoral care team is a notary. If you are interested in this service or would like more information, please ask any of our staff at any time. At St. Joseph's, you will have a pharmacist involved in your care every step of the way. They will oversee and help to manage your medications. They assist your surgeon by providing feedback, recommendations, and management of your medications. The physical therapy team will plan and assist you with your physical rehabilitation after surgery. They will teach you some post-operative exercises as well as work with you on your individual home environment needs. These include things such as using a walker, going up and down stairs, getting in and out of bed, or anything else in your environment that may be a challenge for you after surgery. A physician's assistant or nurse practitioner is a healthcare professional that may work with your surgeon to assist in your overall total care. Our nurses are your advocates and are responsible for managing your overall bedside nursing care during your time in the medical center. They will support your relationship with your surgeon, provide you with care and education, and include your family as part of your healthcare team unless you do not want to have them involved. You may have a respiratory therapist assisting in your overall respiratory care while you are in the hospital. They may provide breathing treatments if ordered and work with you to learn your breathing exercises. Last, but certainly not least, is your surgeon. This is your partner who will perform your surgery, direct your care, and guide you through your rehabilitation process. Now let's talk about some important ways to prepare your home before surgery. Let's start with putting clean sheets on your bed and having freshly washed towels for you to come home to after surgery. Also, if there is a specific chair or sofa that you will be spending time in after surgery, it's a good idea to place a clean blanket or sheet on it. Doing these things can help to reduce the amount of bacteria that you are exposed to in the days following surgery. This helps to minimize your risk of a post-operative infection. Even though you will have some protection from your surgical dressing, you still want your environment as clean as possible until your incision has healed and closed. It is a good idea to grocery shop and make meals ahead of time. You can store some in the freezer for quick access. Also, make arrangements for someone to help with your laundry and meals for 2 to 3 weeks after surgery. You will not have the strength or energy to stand for long periods of time or to lift heavy items like a basket full of laundry. If you are responsible for the care of people, whether children or adults, or you are responsible for the care of pets, please arrange to have someone else care for them in the days surrounding your surgery and for several weeks after. It is important to remove all of your throw rugs temporarily. These rugs are a big fall risk to you, and a fall after surgery is the last thing that you want. Also, it is a good idea to place night lights in areas that you may be in at night, such as the bedroom, hallways, and your bathroom. This also helps to prevent falling. Because you will be temporarily using a walker after surgery, look around your home and imagine that you are using a walker. Do you have clear pathways through your home? Do you need to rearrange some furniture so that you have a safe space to travel with your walker? Please ask friends or family for help if you do need to rearrange your furniture. Another area that is a high risk for you to fall is the tub or shower. Please place non-slip surfaces in these areas. You will have some activity limitations or precautions for a time after surgery. We will discuss these specifically later in this class. But one thing that is helpful is to temporarily relocate some of your most frequently used items closer to waist level. Also, it is helpful to place pillows in low seats that you may use. This can help you get up and down more easily. It's a good idea to arrange for someone to pick up your mail and to prepay your bills ahead of time. This will give you several weeks after surgery before your bills are due again. If you have a condition known as obstructive sleep apnea and use a CPAP machine at night, please have your machine cleaned and up to date with its service by the company that provided your machine. Then, bring your machine, clearly labeled with your name and phone number, to the hospital. Smoking robs your bones and tissues of much-needed oxygen. This becomes a significant risk for you after surgery in the following ways. It reduces your body's ability to heal and can lead to poor outcomes after surgery. Smoking also increases your risk of developing breathing-related complications during and after surgery. We are passionate about your health, so we want to encourage you to stop smoking. Stopping for even a short time before surgery can greatly increase your chance of a successful outcome. We have a smoking cessation program called Tobacco Free You. You have a list of contact numbers in your patient education booklet. Please refer to this list for the phone number. Also, for the health and safety of our patients and staff, St. Joseph Regional Medical Center is a tobacco-free campus. This includes all tobacco products, vapes, and e-cigarettes are included. Many of us tend to underestimate the importance of a healthy diet in having a good surgical outcome. Eating a healthy diet right now will make a difference in how you heal after surgery. It will give your body the nutrients to repair damage to bone and tissue after surgery, and it will support your immune system. It is a good idea to eat healthy, lean, high-quality proteins like chicken, turkey, beans, lentils, tofu, or eggs, as well as plant-based healthy carbohydrates, including whole grains, fruits, or vegetables, as well as healthy fats such as avocados, nuts, olive, or coconut oil. It is important to avoid sugary desserts, highly processed foods that have trans fats or partially hydrogenated oils, and high fructose corn syrup. Proper hydration is important before and after surgery. This also helps to boost your immune system and to minimize complications like infection, constipation, post-operative pneumonia, or urinary tract infections. Drink at least 8 glasses of water each day and avoid drinks with added sugar or sugar substitutes. Avoid drinking alcoholic beverages or drink with great moderation. Alcohol really does not contribute to your nutritional status in any way. It is very important that you discuss all of your vitamins, supplements, and medications, both prescribed and over-the-counter, with your surgeon and with the nurses at your pre-surgery clinic appointment. Many of these can have a big impact on your surgery in the following ways: an increased risk of bleeding, an increased risk of clotting, interactions with anesthetic agents, or interactions with other medications. This is very important for your safety. We provide a safe and confidential environment for you before, during, and after surgery. Please honestly discuss with your doctor if you currently are or have been addicted to pain medications, or if you use any illegal or recreational drugs. This information is imperative for your team to be able to help you with pain control and safety after surgery. We want to work with you to develop a good plan of care that best meets your needs. Starting your pre-op exercises now will help your body and brain connect with these movements more easily after surgery. It is helpful to build this pathway before you have surgical pain. If you have specific questions about insurance coverage that have not yet been answered by your surgeon's office, please call your insurance company. Generally, coverage is verified prior to surgery. You will have the opportunity to fill out advance directives, also known as a living will, at any point while at St. Joseph's. An advance directive is a legal document that conveys your wishes for medical treatment or who should speak for you in case you cannot speak for yourself. This document is kept on file at the hospital and can be updated at any time. This service is provided free of charge. If you have not already done so, please call to schedule your pre-surgery appointment with the St. Joseph Regional Medical Center Pre-Surgery Clinic. You can locate the phone number in your patient education booklet. Also, fill out your health and medication questionnaire along with your discharge planning questionnaire and bring them with you to your pre-surgery appointment. At this appointment, you will discuss the information on these forms as well as other important information concerning your surgery. You may also have some blood tests or an EKG of your heart. This information is important to help keep you safe during surgery and well under anesthesia. It is important that you have help throughout your surgical process from a kind of coach. This person is generally either family or a close friend. They will be an extra set of eyes and ears for you along the way, as well as a cheerleader when the going gets tough or long. They should also provide extra hands-on support at home with chores or meals. It will be important that your coach is also your chauffeur until you have been given clearance to drive. You will not be cleared to drive for a time after surgery. One reason is that you will be on prescription pain medication, and it is not safe or legal to drive while taking this medication. Also, you will have physical restrictions and disability, also making it unsafe. Consider having rings resized so they can easily be removed before surgery. It is not safe to go through surgery with jewelry in place. Your fingers can swell and the circulation could be compromised. It is also an infection risk. There are a few pieces of equipment that we will discuss later that you may want to consider borrowing or purchasing before surgery. A shower chair, an elevated toilet seat, a handheld shower nozzle, and a travel mug or thermos with a lid. Choose your outpatient physical therapy clinic. Then call ahead to notify the clinic of your surgery date and to schedule your first appointment after your hospitalization. If you have home health ordered after surgery, you will not need to schedule your first appointment right away, as you will be having in-home physical therapy. If you have questions about which clinic to choose, please discuss this with your surgeon. St. Joseph Outpatient Rehabilitation Services is a great option for your physical therapy. You will find their contact information in your joint replacement booklet. Please discuss your discharge plan and timing with your surgeon so you know when to schedule your first appointment. Communication is very, very important. Please be sure that you have fully and accurately disclosed your personal health information to your surgeon and the pre-surgery clinic nurses. If anything should change, please notify your surgeon immediately, as well as the pre-surgery clinic. For example, any infections such as dental, bladder, skin, or respiratory. Or if anything changes, such as your diabetic status, urinary issues, or heart conditions. If you are prescribed a new medication, or if you start taking anything additional over the counter, please let your surgeon and the pre-surgery nurses know. By fully communicating this information, your doctor can work with you to optimize your health before you undergo this scheduled surgery. This is important for your optimal outcome. Now you are ready to pack your bags. Here are the things that you want to bring to the hospital with you. Most current list of medications, including what time each dose was last taken, clean, loose-fitting clothing, socks, underwear, and comfortable shoes for physical therapy. You will be walking in the hallways with staff and attending group physical therapy classes. You no longer need to wear hospital gowns. This is a wellness program, and we treat you as such. Also, you will want to bring toiletries, glasses, hearing aids, dentures, and your CPAP machine if you use one. Remember to bring important phone numbers, your cell phone and charger, or a calling card. Also, please bring your driver's license, photo ID, and insurance cards. You may find it helpful to bring pastime activities like a book or magazines. Please bring your total joint replacement handbook. Remove nail polish on at least one fingernail and all toenails on your operative leg. This is important to monitor your oxygenation and circulation during surgery, as well as to minimize your chance of a surgical site infection. As we talked about earlier, please remove all jewelry. If needed, take whatever medications as instructed by the pre-surgery clinic nurses. It is important that you do not eat, drink, smoke, chew gum, or chew tobacco past the specified time, which is typically midnight. If for some reason you have a different window of time, this will be discussed specifically with you. This is imperative to keep you safe while undergoing anesthesia. Life-threatening complications can and will happen when patients disregard these recommendations. Please be honest about these time frames. Take a shower and wash with an antibacterial soap. It is important that you do not shave on or near your surgery site. When you shave with a razor before surgery, it increases your chance of a surgical site infection by making micro nicks in your skin. If needed, staff will shave your surgical site and the area around it with special clippers that protect your skin. After you shower, pat dry with a clean towel. Do not use lotion, powder, deodorant, or makeup. Just stay all natural. We don't mind, we promise. Then put on clean clothes and, if instructed, take certain medications with just a tiny sip of water. You do not need to bring your own walker to the hospital. One will be provided for you to use while you are here. Travel safely and arrive at the hospital at whatever time instructed. This is up to 2 hours before your surgery is scheduled to start. Please make sure that we have a way to reach you in case the time of your surgery changes in any way. Once you arrive, you can go directly to the day surgery department. You do not need to go to admitting. You will have completed the admissions process during your pre-surgery appointment. Your family can remain with you during your time in day surgery. This can be a busy time as staff helps you prepare to go to surgery. During your stay in day surgery, you will review your medications one last time, and your nurse will put that information into the computer for the timing of your next doses after surgery. You will also go over a quick review of your general health. You will have a skin check with 2 nurses to help make sure your skin is healthy for surgery, and then your nurse will help you to complete a skin preparation. This is important in fighting against a surgical site infection. You will be given a warming gown to change into. This can provide warm or cool air. Also, at this time, your consents for surgery will be reviewed and any personal items will be given to your family or transported to your room on the surgical floor. Your next stop will be the pre-op holding department. At this time, your family will be shown to the surgical waiting area. You will have an IV started. Some IV hydration can then be given to you through your IV line, as well as any medication. An anesthesiologist will talk with you to help answer any questions or concerns you may have about your anesthesia. Your surgeon will also talk with you to make sure all of your questions are answered about your surgery. Once you have talked with your doctors, you may be given some medication to help you relax before surgery. This is not a high-stress time. If you would like, you can listen to music for relaxation or distraction. Your anesthesiologist will work with you to decide what type of anesthesia will be right for you. Please notify him or her if you have ever had any complications with anesthesia in the past. Most often, anesthesia consists of a combination of the following: a spinal block. This means that medication is placed in the area around your spine. This will numb your legs for 2 to 6 hours. A regional block. This is when medicine is placed using ultrasound to guide the placement into your mid-thigh around a nerve canal. This may be a single injection or an indwelling catheter. This helps to provide additional pain control for total knee replacement patients. General anesthesia. This means you will be given medication to bring you to an unconscious state. In other words, you will be asleep during your surgery. In your operating room, you will have highly trained and specialized staff. This includes an anesthesia provider, your surgeon and their assistant, OR nurses and surgical techs, along with radiology techs and implant specialists. Safety is always driving your care. You will be specially positioned to help avoid putting excessive pressure on any area of your body. You will have monitors in place as you begin to go to sleep for surgery. Every member of the team will stop and perform something called a timeout. The whole team actively participates in this timeout before surgery begins. They will verify things like your surgical procedure and site, your personal identification, and your allergies. You will be given a preventative antibiotic before your incision is made to help reduce your chances of developing an infection after surgery. You will have soft compression sleeves on your legs, helping to reduce your risk of blood clots. The anesthesia provider will closely monitor and help to regulate your temperature through your warming gown. Once your surgery is complete, you will be transported to the post-anesthesia care unit, also known as the recovery room. Surgery times vary depending on your exact surgical diagnosis and procedure, as well as the extent of surgical correction needed. While you are transported to the recovery room, your surgeon will go to the surgical waiting area to find your family and to update them on how your surgery went. After your family talks with your surgeon, they can then go to the surgical floor. As you start to awaken in the recovery room, you will have specialized one-on-one nursing care with continuous monitoring and your anesthesia provider readily available. Your recovery room time is specific to your individual needs. This will usually range from 1 to 1.5 hours. If this time extends much beyond this time frame, nurses from the recovery room will attempt to locate and notify your family on the surgical floor. Once you have transitioned away from anesthesia and are awake, your anesthesiologist will give the all clear for you to move up to the Center of Excellence on the surgical floor. The Center of Excellence is a dedicated area on the surgical floor where you will have specialized orthopedic staff. Your recovery room nurse will give a detailed report at bedside to your receiving nurse. We encourage you to actively listen and to comment if needed during all of your bedside reports. This is an important way for you to actively participate in your care. Both nurses will check your skin together as part of your post-operative assessment. Visitors may be asked to step out at this time to protect your privacy. Once in your room, your oxygen level and heart rate will be continuously monitored to ensure you are safely maintaining these levels on your own. You will have intermittent monitoring of your other vital signs like blood pressure, breathing rate, and temperature. Your nursing staff will also be watching you for any remaining effects from anesthesia or surgery. We will work with you to learn important breathing exercises to prevent pneumonia, and you will continue to have the SCDs or intermittent compression sleeves on your feet to help minimize the risk of blood clots. Please do not get up without help. We are here for you, and it is our privilege to care for you. You will be a big fall risk after surgery due to many factors like medication, an unfamiliar environment, cords, and being generally weak and unsteady after surgery. Anytime you need to get up, we ask that you use your call light to ask for assistance. You will also have a bed alarm on for a time that will make a loud alarm noise if you are trying to get up and have forgotten to get help. You will have a lot of help very quickly. Staff will always use something called a gait belt when getting you in and out of bed and walking with you. You should also have non-skid footwear or socks on whenever you are walking. This is important to help prevent slipping and falling. As discussed earlier, your medications are ordered by your doctor and overseen and managed by a pharmacist and then administered by your nurses. For your safety, we will identify you each time by scanning your armband, as well as asking you questions such as your name and date of birth. Your medications will also be scanned into the computer to match you and your orders. Staff will explain your medications to you along with the side effects to be aware of. Throughout your hospitalization, we will assess you frequently for pain. We will ask about your pain rating on a 0 to 10 scale. 0 is no pain, 2 is mild, 4 is nagging and annoying, 6 is quite a lot, 8 is severe, and 10 is the worst pain that you can imagine. In addition to your number rating, we also want to know what type of pain you are having. For example, aching, burning, or sharp. It will be important to know the location and if anything such as a position change provides relief from the pain. Our goals for you are to help you meet your realistic goals. We emphasize realistic because we know you will have pain after surgery. A goal of 0 will not be realistic. A good goal is to help provide enough pain relief that you are still able to rest and participate in your activities while never compromising your safety. The best personalized approach will hit pain from many different angles. Cold therapy to reduce swelling, keeping your eye on those goals that you have identified, and getting moving so that your muscles don't become stiff from inactivity. Also, please honestly communicate your pain to your care team. This will help us to help you. Try not to worry about pain, but it will be important for you to understand your pain. One of the big culprits of pain after surgery is inflammation or swelling and the physical disruption of tissue. We call this acute surgical pain. There are some things that you can do after surgery to help minimize this type of pain. Cold therapy, also known as ice packs, good body mechanics and alignment, as well as walking and repositioning. Later in this class, we will demonstrate some cold therapy wraps that you may receive from the hospital if ordered by your surgeon. There is also something called acute on chronic pain. This is when a patient has a long history of pain and prescription medications to manage that pain, coupled with the acute pain of surgery. This presents a special challenge in managing your pain after surgery. Please discuss fully with your surgeon your history of pain medication use and exactly how much you take and how often. Not just what and how it was prescribed, but actually how you are using it. This will help your surgeon plan effectively for helping to manage your post-operative pain. As discussed, you will become very familiar with a 0 to 10 pain scale and helping to describe the exact type of pain you feel as well as the location. An important point to make here is that the response you get to a therapeutic dose of pain medication is the response you get. More medicine will generally not increase the response. It will only decrease your level of consciousness and your drive to breathe. This becomes dangerous to you. We work hard to keep you at a therapeutic level of pain management while never compromising your safety. Safety will always trump pain management. Let's talk about some common myths about pain management. Number 1, you should wait in bed because the pain is too bad to get up. After having a solid night of sleep, often each one of us will wake up feeling stiff and sore until we get moving. This same thing happens after surgery and can be exaggerated. Sometimes patients feel they hurt too bad to get up, but if they can push themselves in the moment to get up and walk, when they get back to bed, they rest better overall and with less pain. Myth number 2, you won't have pain after surgery. It is surprising how many people are shocked to have pain after surgery. Our surgeons have asked us to reiterate to you that you can expect to have pain after surgery. There is no way to totally avoid pain. Instead, we work with you to keep it manageable. Myth number 3, pain means there is something wrong. This is both true and false. Pain is protective to your body. It helps you know when something may not be right. If you place your hand on a hot surface, pain lets you know to remove it quickly, which is how it prevents you from sustaining further damage. Before surgery, pain was most likely letting you know that something wasn't right. After surgery, pain will be telling you that something big has happened and it didn't feel good. Like we discussed before, it is helpful to anticipate this kind of pain and control your thoughts about it so that you don't panic. Myth number 4, more pain medicine means more pain control. This is reiterating what we already discussed. Pain medicine has a point where it is no longer working more on the pain no matter how much you take. We will help to keep you safe while you are in the hospital, but once you go home, it will be important for your coach and yourself to help keep careful track of your pain medications so that you do not accidentally take too many. One thing that is helpful is to keep a tablet by your medication and write down each dose and time. You can also use pill boxes to help keep track. Myth number 5. You will become addicted to pain medication while in the hospital. Addiction happens over time. Your hospitalization is too short of a time frame to develop an addiction to pain medicine. However, there is a risk, weeks and months following surgery, that your body may continuously start to crave pain medicine. To avoid this, work to lengthen your time between doses and steadily decrease your doses in the days and weeks following surgery. Never take more pain medication than prescribed, and if you feel you'd need to, please inform your surgeon. They may need to prescribe a different medication for you. Myth number 6. You should skip exercises or physical therapy and walking when you are hurting. Like we talked about earlier, sometimes pushing yourself through the pain to get moving will ultimately help you rest better and will decrease your overall pain. You can even just walk loops through your home or in the mall. Once you are able to start eating and are tolerating some liquids with no nausea, your nurse will start to advance you toward a regular diet. Take it slow. Eating quickly can trigger nausea and complicate things if you are constipated. When you have started to eat solid food, you will be started on pain pills in preparation for your discharge to home. If you have any special diet considerations, please let your surgeon and nursing staff know. This would be any allergies, if you are diabetic, need a heart-healthy diet, or are vegan or vegetarian. Your family can either purchase a meal of their choice in the cafeteria, or they can order a tray to eat with you for a small fee. One of our dietary aides will come to your room to take your order for every meal. For your best outcome after surgery, we will help you to stand at your bedside and also to walk with assistance the same day of your surgery. This helps to greatly reduce your risk of complications after surgery, such as pneumonia, blood clots, and excessive pain. Standing will not cause damage to your joint, but it may feel uncomfortable at first. You will use a front-wheeled walker and a gait belt for stability and safety. We will demonstrate this later in the class. We have been asked by staff and physicians to talk about sleep expectations after surgery. Undergoing anesthesia often seems to interfere with patients' normal sleep patterns for at least the first night after surgery. This can leave your body confused about if it is day or night. Also, you will be in an unfamiliar environment with unusual sounds, a different bed and pillow, and you will be having some pain. Also, staff will be in and out of your room, keeping a close eye on you and your vital signs and pain. Try not to get frustrated about lack of sleep, but just focus on relaxing. Watching TV is sometimes a good distraction from the frustration of lack of sleep your first night. Staff will work to keep the unit quiet at night and to keep lights dim, creating somewhat of a quiet zone. We can also provide you with a white noise machine, a sleep aid if ordered, earplugs, and we can adjust your room temperature to better meet your needs. Also, by being active and walking and getting up to the bathroom, as well as breathing exercises and ankle pump exercises, you can help to wear yourself out in preparation for sleep. It is hard to sleep if you haven't moved much all day. Also, please tell us what you normally do at home to help with sleep. The next day after surgery, you will be busy. You will have some early morning blood tests and your IV fluids will be stopped. Your soft IV catheter will remain in your arm, but the continuous flow of fluids will be stopped. Your nurse will change your surgical dressings and will help you with bathing and personal care. Your nursing staff will help to teach you how to continue this on your own once home. You will be continuing to do your deep breathing exercises and to use your incentive spirometer, which is a device that will help with your breathing exercises. Also, don't forget to do your ankle pump exercises very frequently throughout the day. We will help to get you out of bed for every meal. It is helpful for you to spend small amounts of time out of bed in a chair. You will attend physical therapy classes twice a day while in the hospital. Our physical therapy team will work with you and possibly an occupational therapist. They will practice with you on how to get in and out of bed. This is where it is important that you bring comfortable shoes to the hospital, as you will walk with your therapy team in the hallway. We will continue to assist you in getting up and down to the bathroom, which is actually good for you. You will not have a catheter in your bladder unless your surgeon decides one is necessary for your safety. Catheters provide an unnecessary risk of a bladder infection developing. It is much better for you to move back and forth to the bathroom. You will have many people in and out of your room. Some of these include our discharge planner and one of our chaplains. Try to rest between activities and visitors. You may have some precautions after your surgery. If you have a knee replacement surgery, please do not rest with a pillow behind your knee. When you rest in this position, it puts you at risk to form scar tissue, meaning you may never be able to get your knee completely straight. Unfortunately, this will be the most comfortable position for you and will provide a level of pain relief, but it is imperative that you not rest in this position. For total hip replacement patients, depending on your surgery specifics, you may have some precautions after surgery to prevent your new joint from dislocating until your muscles have healed and strengthened. Staff will work with you while you are in the hospital to learn these precautions and how to live with them for 12 weeks if they are ordered. We will introduce them to you here. No crossing midline with your operative leg. No bending past 90 degrees through your hips, like bending down to tie your shoe or sitting in a low chair where your knees are higher than your hips. And no twisting through the hips. You also could be asked not to bridge, which is the position you may use to lift your bottom off of the bed if you were adjusting linen, or to extend your leg out behind you as if you were bowling. You may go home the next day after surgery, or you may stay for an additional day depending on your specific needs after surgery. Your doctor will work with you and your nurses and therapists to find the right discharge timing for you. Once your surgeon has given discharge orders, these orders will be processed by the lead or charge nurse for the day. They will verify your orders, fax your prescriptions, verify your follow-up appointments, and print an educational packet for your bedside nurse to review with you. It is helpful to have your coach present when your discharge teaching is taking place. This gives them the knowledge and skills to help you at home, and it also provides a good opportunity for them to ask questions. You may not remember all of the information you are given at discharge, which is why an extra set of eyes and ears will be very helpful. Before you leave the hospital, you will be given an in-hand prescription for pain medicine and a walker. It is helpful if your coach can pick these items up before you leave, or if they can get them on the way home. It is important to have these items when you are arriving home so you do not have to leave or be left alone. Your discharge planner will review your plan and check with you to make sure you have the support you need once home. Your bedside clinical nurse will make sure you and your coach know how and when to change your dressings. They will remove your IV catheter from your arm and help you to pack your belongings. They will go over all information in your discharge packet, including your surgery, your medications, any follow-up appointments you may have, as well as what your plans are for exercises. And they will review any complications that you should watch for. You will also have contact information in your packet, as well as in your patient education handbook. The phone number to the nurses' station on the surgical floor is a 24/7 contact number. You can speak with a nurse at any time if needed. You will also have the phone number for the nurse navigator. You may need to leave a message, but she will return your call. As we discussed earlier, blood clots are a big risk to patients who have had a total joint replacement, especially a knee or a hip. We will talk about the signs and symptoms in a few minutes, but first, let's talk about prevention. Some of this we have previously discussed, but we'll review again. First is hydration. It is very important that you drink plenty of water and stay very well hydrated. This helps to reduce the viscosity or thickness of your blood. Ankle pump exercises help to keep blood moving in your calves, where blood clots generally form when you are not as active as usual. Early standing and walking is extremely important in preventing blood clots, as well as the soft compression sleeves that will be on your feet while you are in bed. Please do not hesitate to remind staff to keep your pumps turned on any time that you are in bed. Not having these on for even a short time can increase your risk of a blood clot. It is important to avoid pillows or pressure on the back of your leg or knee area for a prolonged amount of time. This can decrease the blood flow, putting you at a higher risk. You will be on a blood thinner after surgery, generally for about 30 days. Your physician will choose the right blood thinner for you based on your specific health history and risk factors. If you have warfarin, also known as Coumadin, prescribed, some blood testing will be required. This medication has many interactions with different foods and medications. A pharmacist will meet with you before you are discharged to teach you more about this medicine and how to manage your diet and blood testing. In the 30 days that you may be on warfarin, it will be important that you notify the pharmacist or clinic helping you manage your warfarin of any new medication that you start, prescribed or over-the-counter. Over-the-counter pain medication like ibuprofen or aspirin, as well as antibiotics, are some of the medications that can increase the effects of your warfarin, making your blood too thin. It is very important to communicate clearly with your doctors and pharmacists during this month following surgery. Let's briefly discuss possible side effects from blood thinners in general. Bruising and bleeding. We want you to call your surgeon or seek emergency help for signs of bleeding, which means blood anywhere it should not be. For example, urine, stool, emesis, continued bleeding from your incision, or a large bruise that continues to grow. Also, please get emergency help if you suspect you could be having an allergic reaction to your blood thinner or any of your other medications. Signs and symptoms of a severe allergic reaction include a rash, hives, or difficulty breathing. Once you return home, your coach should plan to stay with you for the first 24 to 48 hours. They should also be available to you at night for assistance with getting up and down to the bathroom and keeping track of your pain medications. Please make sure that you have help available even during the day should you need additional assistance with meals, laundry, or getting up and down. Don't forget, you won't be driving yourself for a bit, so your helpers will also be your transportation to and from any appointments. Here are a couple of things to highlight to you. Keep your surroundings as clean as possible until your incision has healed. Use extreme caution with pets. They can be a fall risk as well as an infection risk. Always wash your hands or have your coach wash their hands before changing your dressings. Ice, ice, ice. This can really help with pain and swelling. Just be careful to always have a layer between your skin and the ice packs so that you do not get frostbite. Follow the manufacturer's recommendations for safety on whatever system you are using. Elevation is very important in helping to reduce your swelling and pain. If you had knee surgery, spend time laying on the sofa or in bed with your knee at least 6 inches over your heart, but make sure there is no bend in your knee. So if your knee is 6 inches above, your foot most likely will be much higher. You can prop your foot up on the back of your sofa or build a wedge shape out of pillows or bolsters. If you had a hip replacement surgery, spend 20 to 30 minutes several times each day laying on your non-operative side. This can provide some elevation for your hip and will prevent something called dependent edema, or swelling and fluids pooling low in your hip and buttocks area from gravity. Remember to continue your breathing exercises and ankle pumps until you have returned to a normal level of activity. Eat healthy and stay hydrated to give your body what it needs to heal and to keep your immune system as strong as it can be. Take your medications exactly as prescribed and call your surgeon if you need further directions or assistance. Last but not least, keep your chin up. Sometimes your brain begins to heal ahead of your body. You are anxious to get back to life, but your recovery process may be taking longer than you hoped. This is normal. Most patients experience a time where they may feel that life is passing them by. Try to keep focused on your goals and to distract yourself with hobbies or other activities. Before you know it, you will look back on this. Let's talk about caution and review a couple of important things. Number 1, do not submerge your incision underwater until it has fully healed and closed. You can shower, but no tub baths, hot tubs, or swimming. Next, do not sit in a chair with your legs hanging down for more than 30 minutes at a time. This will cause increased pain and swelling and increase the risk of a blood clot. As we talked about, avoid pillows behind your knee, and please stay ahead of constipation. Stay on bowel medications as recommended until your bowels have returned to a regular pattern. Staying active and hydrated will also help to prevent excessive constipation. Remember not to drive until you have been given clearance from your surgeon, and don't forget that it is important you do not add any medications without guidance from your surgeon. Notify your surgeon if you have any questions or concerns. Here are some important reasons that you should contact your surgeon once you go home. If you develop a fever of 101 or greater, or have chills and a cough, or are generally feeling very weak and achy. Also, if you have a sudden increase in your pain and swelling. If your skin becomes itchy or swollen, or has a rash. As discussed, if you cannot have a bowel movement. If you have trouble urinating and you have burning and pain when you do urinate. If you have persistent nausea or vomiting, or for any other questions about your surgery. Seek emergency care immediately if you develop signs of a surgical site infection. This would be if your incision becomes swollen, red, drains pus, smells foul, or pulls apart. Also, seek emergency care if you develop signs or symptoms of blood clots. Some of the signs and symptoms would be one or both of your calves feels warm, is painful, and swollen. It may look red as well. Just to note, occasionally blood clots can develop in your arms. If in your calf, you would likely experience pain when standing or with movement. This pain is often sharp. If the clot travels from your extremity, it may travel first to your lungs. If you experience chest pain, trouble breathing, suddenly feel lightheaded, or cough up blood, please dial 911. This is a life-threatening emergency. Also seek emergency help if you are actively bleeding. You may have some slight drainage on your dressings, but you should not be actively bleeding and soaking through bandages. Please get help immediately to stop the bleeding. Exercise is very important before surgery, while you are in the hospital, and after you go home. It is imperative that you practice your exercises as you are guided by your therapists and doctor. This will help you to have a good surgical outcome. Now, let's turn it over to our therapists.
Welcome to the Physical and Occupational Therapy portion of your Steps for Success class. When you have a total hip or knee replacement surgery, being highly proactive and compliant with physical therapy is absolutely imperative. You will only achieve the outcome you want through a strong commitment to your exercises. This will mean learning how to push yourself through pain at times and exercising in your home 2 to 3 times per day. After you return home, you will likely have outpatient physical therapy appointments 2 to 3 times each week until advised otherwise by your surgeon. I cannot stress the importance enough for these exercises. Please refer to the exercise section in your Total Joint Replacement Handbook so you can follow along. These exercises are designed to maintain or improve current strength and flexibility both before and after surgery, as well as promote good healing and alignment for recovery after surgery. You will practice exercises on both of your legs, not just the surgical leg. The supine triceps extension exercise is important to help you build strength in your arms before surgery. You will rely on your arms and upper body to assist you in getting up and down from a seated position or in and out of bed. Lay down on your back, bend your knees up for comfort. Lift one arm up over your head and bend the elbow so it points directly at the ceiling. Holding the weight in your hand, keep the elbow in the same position and straighten the arm so the weight is going up towards the ceiling. Return to start position. Repeat this 8 to 10 times with each arm. Practicing seated press-ups will also assist you in strengthening your arms and upper body to better assist you after surgery. This is one of the most important exercises to practice before surgery. Sit in a sturdy chair with arms. Press down with your palms to lift your buttocks up from the chair. Hold 3 to 5 seconds and then slowly lower yourself back down. Repeat this 10 to 20 times. Following surgery, ankle pumps will help prevent blood clots from forming in your calves. As we talked about earlier, blood clots are a significant risk to patients after they have a hip or knee replacement. It is important to practice these ankle pump exercises frequently after surgery until you have returned to a normal level of activity. Practice these multiple times per day, especially when you have been resting or not active. Flex both of your feet down vigorously, like you're pressing on the gas pedal of a car. Then pull toes up toward your chin. Repeat this for about 30 seconds. Practice deep breathing exercises at the same time. Breathe in slowly, taking a deep breath. Then relax and exhale deeply. Deep breathing exercises should be practiced each time you practice your ankle pumps. The breathing exercises help to prevent fluid from settling in your lungs after surgery and becoming infected or causing pneumonia. Your quadriceps are a very important muscle group in providing support and stability for your new joint after surgery. Lie in bed with your leg out in front of you. Press the back of your knee down into the bed, tightening the thigh muscles. Hold for 3 seconds and then relax. Repeat this exercise 10 to 20 times. Heel slides will be important before and after surgery. Begin by laying down on your back with your legs straight out in front of you. Slide your heel along the bed towards your buttocks, bending your knee as far as possible. Straighten slowly, again sliding the heel along the bed as you straighten. Repeat these slides 10 to 20 times. Gluteal sets are also known as glute sets. Your gluteal muscles or buttocks are important in providing stability for you after surgery. Glute sets are an important exercise to strengthen these muscles. Simply put, you will squeeze your buttocks together tightly. Hold this for 3 seconds and then relax. Repeat this 10 to 20 times. Straight leg raises are another important leg strengthening exercise. Lie down. Bend your non-operative legs slightly to relieve pressure in your low back. With the toes pointed toward the ceiling and the leg held straight, flex your quadriceps muscle, raise your leg 8 to 12 inches, hold for a couple of seconds, and then slowly lower the leg back down and relax the quadriceps. Please repeat this 10 to 20 times. If this causes pain, do not continue with this exercise. Hip abduction and adduction exercises are also known as snow angels. These exercises work to provide stability by strengthening important muscles that surround your hip joint. Having stability through the hips is important for both hip replacement and knee replacement patients. Lie in bed with your feet slightly apart. Do not turn your toes outward when you do this exercise. Flex your quadriceps. Keep knee, foot, and toes pointed toward the ceiling. Slowly slide your leg out to the side and then back to the original position without crossing the midline of your body. Repeat this 10 to 20 times. Short arc quads are another quadricep exercise to help with a quick and smooth recovery after surgery by increasing your strength in the area around your surgical site. Lie on your back. Place a large towel roll or pillow under your knee, approximately 6 to 8 inches in diameter. Flex your quadriceps, lift your foot up. Your knee should remain on the towel roll. Hold for 3 seconds, then lower the foot slowly back down and relax your quadriceps completely. Repeat this 10 to 20 times. A variation of the short arc quads is the long arc quads. These exercises work in a similar way to provide extra strength for the quadriceps. Sit on a firm chair with both feet flat on the floor. Flex your quadriceps, then lift your foot slowly until your knee is straight. Hold for 3 seconds, and then lower your foot slowly back down to the floor. Repeat this exercise 10 to 20 times. After surgery, you will be prescribed a walker to be used for stability until your muscles have strengthened around your new joint. It is common for patients to be weak and unstable in the days and weeks following surgery. For your safety, while you are in the medical center, staff will assist you to get in and out of bed, as well as in and out of chairs, and in and out of the bathroom, as well as to walk. They will always use something called a gait belt to protect both you and themselves from sustaining injuries from a patient fall. They will help you use a walker as well. It is important that you learn how to use the walker correctly. After a total knee or hip replacement, you are generally safe to put your full weight on the operative leg without damaging your new joint. The pain will be limiting initially, and the walker will help keep you stable and avoid a disastrous fall. Let's review the safe way to get in and out of a chair and walk after surgery. First, make sure that your walker is properly adjusted to the height of your wrists. Notice that staff are using the gait belt for safety. Also notice that you will keep your operative leg out in front of you as you get up. Do not pull on the walker to stand, it will tip. Instead, push up with your arms. Also, it is important to keep your surgical leg inside the frame of the walker, keeping your weight on your hands and arms as you step forward with your non-operative leg. You will advance the walker, place your operative foot inside the walker, take the weight through your arms, and then advance the non-operative leg. Avoid getting ahead of or behind the frame of the walker. Keep focused when you are learning. It will quickly become a habit to use good technique. Follow the instructions of your surgeon and physical therapist on how long you should continue to use the walker after you go home. The length of time varies from patient to patient depending on individual factors and the specifics of your joint surgery. After surgery, you will need extra help for a time before you transition completely back to caring for yourself. As we discussed earlier, it is important that you have a helper or coach to support you after surgery as you regain your independence. After most hip replacement surgeries and some knee replacement surgeries, patients may struggle for a time with basic activities of daily living, or ADLs. ADLs include basic care activities like getting dressed, showering, and using the toilet. If occupational therapy is needed for you after surgery, our therapists will come to visit you while you're in the hospital. They will provide you with some adaptive equipment, and they will teach you how to use this equipment. Let's start with the sock aid. The sock aid will help patients who have any physical precautions or constraints that keep them from being able to bend down far enough to put their socks on. Begin by pulling your sock onto the sock aid until the toes are flat at the end. For longer socks, you can simply accordion the sock over the device, but be sure to have the toes flat against the end. Then, go fishing for your foot. Place your foot in the sock aid with your toes pointed down. Using the ropes, pull the sock aid up towards your calf, and voila, your sock is on. The next item that patients often find helpful after surgery is a long-handled reacher or grabber. This is helpful for many things, picking up items from the floor or getting dressed. Let's watch how you can use this to help get yourself dressed. Next, we will learn how to get your shoes off and on without always needing your coach to assist you. We will use two pieces of equipment together to accomplish this: the long-handled reacher or grabber and the long-handled shoe horn. To take off your shoes, place the shoe horn on the back of your shoe and gently push your shoe off. It helps if you have loosely tied shoes to begin with or a slip-on shoe. To get your shoe back on, grab the tongue or top of your shoe with the reacher. Place the shoe horn in the back of the shoe. Insert your toes first and then slide your foot down the shoe horn and into your shoe. If you have lace-up shoes and are having difficulty, we can provide you with elastic shoelaces to temporarily replace your regular shoelaces. This turns a lace-up shoe into a slip-on shoe. The next place that people often find challenging after a hip or knee replacement is the shower. It will be important that you purchase, rent, or borrow a simple shower chair to use in the weeks following surgery. The shower is a fall risk after surgery. Generally, shower seats are not covered by insurance, but if you would like to clarify, please call your insurance company. These can be purchased at your local medical supply store, large chain general store, or possibly a secondhand store. Also, you may want to borrow one from a friend, a relative, a church loan closet, or the senior center. Take time to find a shower chair and also a toilet seat riser or elevated toilet seat before surgery. We will talk about the toilet seat in a moment. One word of caution: if you are using this equipment secondhand, make sure to sanitize the items completely before you use them. This is important in helping to prevent a surgical site infection. When getting into a tub shower, back up with your walker until you feel the tub wall on the back of your calves. Reach back with your arm and find the seat. Place your surgical leg out in front of you and sit down. Move your walker aside. Lean back slightly and with both hands on the chair for support and balance, lift your legs one at a time over the ledge of the bathtub and into the shower. If you had a hip replacement, be careful not to bend past 90 degrees at the hip. This is basically the same way you will get in and out of your car. We will work with you to learn this while you are in the hospital. Once you are in the shower, you can use a long-handled sponge to scrub hard-to-reach areas like your feet and back. Rock side to side on the seat to wash your bottom area. After your shower, while you're still sitting, wrap a towel around the long-handled sponge, keeping a grip on the ends of the towel, and use it in the same way to dry off hard-to-reach areas. Generally, the thing patients least want help with after they have a surgery is toileting. Your occupational therapist can help you learn how to use the toilet independently after surgery. First, an elevated toilet seat is very helpful to have after surgery. This can be attached to your toilet itself, or you can remove the bucket from a freestanding bedside commode and place this over your toilet. It is helpful to have handles or something that you can safely grab onto to assist with getting up and down off the toilet. As we talked about previously, generally these are not covered by insurance, but take the time to locate one if possible. The next item that can be very helpful after surgery for patients that have a difficult time reaching behind to wipe is a toilet aid. Squeeze the handle to open the tongs and wrap a generous amount of toilet paper around the end of the toilet aid. Be sure to leave a tail of toilet paper for you to grip so that it does not unravel while you are wiping. Stand and squat and then reach back to wipe. It is helpful to have a plastic bag lining your trash can that you can unravel the paper and drop it into. This helps prevent a mess around your toilet. One of the best things that you can do after surgery to help control your pain is to help control your swelling. One way to help is to elevate the surgery site above your heart. For knee replacement patients, spend time lying on your back with the knee elevated at least 6 inches above your heart while ensuring that there is no bend in your knee. The leg should be straight. For hip replacement surgeries, spend 20 to 30 minutes 3 to 4 times each day lying on the non-operative side. This will provide some level of elevation and will discourage fluid from pooling in the back of your hip area. Cold therapy or ice packs are very important when it comes to reducing swelling. After surgery, while you're in the hospital, you will be given a cold therapy wrap with 2 sets of gel packs. We will teach you how to safely use these gel packs while you are staying in the hospital. Follow the directions completely once you're at home to prevent any skin injuries like frostbite. Do not sleep at night with this on, but rather use during your waking hours. For knee patients, here is how you place the wrap on your knee. For hip patients, here is how you place the gel wrap around your hip. In summary, You have a whole team to cheerlead and help teach you how to get back to your regular life, resulting in a great surgical outcome. We cannot stress enough the importance of doing your exercises faithfully, even when you don't feel like it. You will have good and bad days, but expect the bad days to get further and further in the rearview mirror, especially if you commit to the success of this surgery.
Thank you very much for choosing St. Joseph Regional Medical Center for your surgery and care. We are with you every step of the way. Please know that you have a team of experts on your side. We are together in health.